The new COVID-19 variant known as Eris is now the dominant strain in the U.S., but an even newer variant is now raising concerns. Medical reporter Liz Bonus explains why.
Hey there, hello to you. What those tracking this newer variant are concerned about is what's called this highly mutated strain. Its nickname is Parola, which by definition is a plant that lacks a permanent woody stem. Here's what we know about it, and here's what we don't. We don't know how many of those who are hospitalized now are infected with this new Parola strain. We do know, however, that hospitalizations are climbing, according to the CDC COVID data tracker. Infectious disease specialist Dr. Stephen Blatt, who tracks the COVID-19 numbers for one of Ohio's largest hospital systems, TriHealth, says we also do know, for the first time in a long time, his team is seeing
couple people in the ICU, which is really unusual. We haven't seen ICU patients in probably a couple of months.
We also do know that Parola, or BA2.86, is different than previous COVID-19 variants. The CDC describes it as a new lineage.
BA2.86 is the one that's just been identified. Only one case of it here in the United States so far, but it has a lot of variation in its mutations, like 36 different mutations, which is dramatically different from the Omicron variants we've seen, which are maybe one or two mutations different from the previous variants.
So that means we also don't know if the new vaccine this fall will provide protection against severe illness from it, or whether your previous immunity from infection will keep you from getting very sick and ending up in the hospital if you do get it. Now, some hospitals are starting to bring back mask mandates in anticipation of the spread of this.
As of today, August 24th, 2023. Important to date things because we know things can change quickly. I spoke with the CDC today, and the latest about this new highly mutated form of COVID-19 called BA286 is that there are 9 cases that have been documented around the world. That could change, 2 in the United States. We don't know if it's more transmissible, if it makes people sicker, or to what extent previous infection with COVID or vaccination gives you protection. We're going to learn about that more in the weeks and months to come. Now, the good news is that the circulating forms of COVID-19 now are covered by this new vaccine that's expected to become available around mid-September. So stay tuned for more news.
Health experts are closely watching the latest COVID variant, which they say can evade immunity even if you've been vaccinated or recently had COVID. There are only about a dozen worldwide cases of this variant called BA2.86. Experts say it's a highly mutated form of the coronavirus. The CDC says so far the variant does not appear to make people sicker, and it's believed that antiviral treatments like Paxlovid could still work against it. But it is too early to know whether the updated booster shots expected in the fall will protect against it.
COVID cases are on the rise across the nation and in our area, which means something many of us thought we'd seen the last of is back. Businesses, hospitals, even colleges, including one in our area, reinstating mask mandates. So will there be more to come as we head into the fall? And are people ready to be forced to mask up again? Kendall Green joins us live in the studio. And Kendall, what do health experts have to say about it?
Hi, good evening, Steve. They're saying if you don't have them already, it may be a good idea to stock up, and if you do, keep them handy. With the current COVID trend we're seeing, more mask mandates could be in fall's forecast among companies and colleges. New data shows we're not out of the woods just yet with COVID-19. In fact, the numbers show the last few weeks it's sent more Americans to the hospital, with an increase of more than 20% from last week in deaths and hospitalizations nationwide.
We know that there was a lot of circulating COVID right now.
Dr. Stephanie Silvera, an epidemiologist and professor of public health at Montclair State University, urges caution of the new threat on the horizon. Though the number of cases of variant BA.2.86 are sparse in the U.S., the newest strain is predicted to be the most infectious yet, while it's on the rise in Europe.
There's a growing concern that our current vaccines are not going to be as effective as they have been in terms of reducing both spread and severity of the illness.
Combined with that and rising case counts, companies like California-based Kaiser Permanente mandated its staff wear masks on certain floors of their facility. Closer to home, Upstate Medical University in New York and Rutgers University took similar steps. The epidemiologists in favor of calls for caution considering the newest variant's impact overseas, though fewer cases have been reported in the United States.
In thinking about what is the next step in terms of public health and how to prevent further spread, unfortunately, masking is something that we need to consider, even though most people don't want to.
Some New Yorkers telling Fox 5 they're willing to comply with potential mandates.
I don't want to get sick. I like being alive.
I think that it would be super helpful if it's spreading again to stop the spread.
The mask can either be healthy, so for people who are sick, it can help them, but other people, I feel like it's half.
Dr. Silvera making a bold prediction heading into fall.
I think we may hit a tipping point this fall, especially as students come back to campus, where that masking might be required. And I think the number of college campuses requiring it are likely to increase.
Now, with testing down in the United States by 90%, it makes surveillance among health officials harder, complicating the process of tracking those newly developing strands. Now, the numbers are the guides going forward. Steve.
All right, thanks, Ken.
Shalom, shalom. First and foremost, I'm going to give all praises, honor, and great glory to Yahweh, Ba'Hashem, Yahweh Shai, Ba'Hashem, Akadash. Double honors to the apostles and elders of Great Millstone, every wealth, and salutations to the elect, pushing the truth to the four corners of the earth in truth and in sincerity. Alright, in this particular video, which is going to be a short one, I just want to play this and get one scripture. Matter of fact, I'm going to get that scripture first. 1 Thessalonians 5:3 KJV. It's a famous scripture, but let's get it and then let's get this video. This video, I had stumbled across it because you have GMS Austere Man. He said, if this is true, oh boy. And he went to AJ's, I'm gonna say that because they got YouTube's algorithm against that dude. So he went to his website right here. As you can see, that's what I'm on right here. And go to the 35 mark. And man, hey, we told you so. That's all I'm going to say. 1 Thessalonians 5:3, for when they shall say peace and safety, which they're saying right now, then sudden destruction cometh upon them as travail upon a woman with child, and they shall not escape.
And they said, you got to warn people. Tuesday, we got called in, the managers, and told that by the middle of September, that the new policy's being written, that this is done. They were told this is happening. This is not hypothetical. You will all have to wear masks again, and so will airport employees. Then, by the middle of October, they are going to say that everyone flying has to wear a mask. And in the meetings, people began to ask them, well, why is this happening? They said, well, because of the new variant in Canada, and because of the WHO, they may, declare this, but regardless, we've been told this is going to happen. And then they were told, we expect by December a return to the full COVID protocol of 2020-2021. And I was given many more details. I wrote down notes on it.